Hello, doctors. Today we are going to learn about the concept, evolution, and scope of the family medicine. So in the next uh, sessions, we will be like the next slides. We'll be covering how family medicine is developed and what its core concepts are, and why it is very vital to primary care and how it bridges the preventive, curative, and rehabilitative services in clinical practice. So you have to keep in mind our clinical focus, that how a family physician approaches everyday OPD problems, when to refer, and how we can coordinate care with IPD teams. So let's begin with today's session. Family medicine, it is a clinical specialty that provides comprehensive, continuous care, health care for individuals and families across ages and genders. So the important words are comprehensive, means we look at the whole person and the family context, and so that is about the comprehensive word. That is the next is the continuous healthcare, means continuous meaning care across time and transition. So unlike a single organ specialty, family medicine is patient centered rather than disease centered. We manage acute problems, stabilize chronic illness, and provide preventive care and coordinate referrals. So, practically, this means the family physician is often the first contact, the coordinator, and the long term follow up provider. Okay, so that's about the introduction of today's session. Next is the evolution and development. So it is kind of a like brief history. Family medicine is emerged in the 1960s as a response to increasing fragmentation. Specialists treating single organs left gaps in continuity and community care. Over decades, general practice evolved into a formal, evidence based academic specialty with training programs worldwide. The WHO recognizes family medicine as central to strong primary care systems. In India, postgraduate family medicine like MD or DNB was introduced to formalize the training, equipping the physicians with competencies in clinical care, community health, and system based practice. The thing you have to remember is family medicine is not an old fashioned general practice. It is a modern, academically grounded discipline shaped for the needs of the populations. So that's about the so that is how a community benefit, how like from having a family physicians. Okay, so that is about the evolution and development of family medicine. Next is the core concept of the family medicine. So here the concepts we have to remember are comprehensiveness, continuity, coordination, and context. So comprehensive means we handle a wide range of problems from the infections to mental health, continuity, and we follow patients over years and life stages. So that is about the comprehensive. Next point is coordination. Coordination is we manage the referrals, investigations, and integrate the specialized advice. Third is the context. Context means we treat patients within their family and community setting, which affects the risk factors, adherence, and the outcomes. So clinically, this means our assessment includes the medical, psychological, and social factors. The biopsychosocial model in the it means the biological or the medical, psychological, and the social model in the practice. So, how does a family context shape this problem? So, examples like in uncontrolled diabetes due to family diet and all. So that is how the context means in case like if there is any diabetes, uncontrolled diabetes running in the family, we will be treating the patients within their family and the community settings. So that's about the concept of family medicine. Next is the importance of family medicine in the primary care. Why family medicine is important? First, it acts as the first point of contact, early diagnosis, timely treatment, and prevention. Second, it reduces unnecessary referrals and tertiary care burdened by the managing common conditions at primary level. Third, it improves patient satisfaction through continuity and trust, which improves long term outcomes. Fourth, the family physicians are critical in public health activities like screening, vaccination drives, and health education. So, from a system view, family medicine lowers the cost and improves the access. Clinically, it means more problems solved at the OPD level with referrals reserved for the complex issues. So it's very efficient, so that while doing these things, it is very efficient. It's very efficient, and patient-centered outcomes are seen in this, seen by the family medicine department. And next is the like how we can manage that, like what are the things of family medicine, what importance of family medicine in the OPD management. So, OPD management, as you know, is the core of family medicine. Common OPD problems include hypertension, diabetes, respiratory infections, chronic cough, skin conditions, and mental health issues around. So, OPD prioritize like accurate diagnosis, initial stabilization, lifestyle counseling, and arranging appropriate investigations. For chronic diseases, we have to set a measurable targets, for example, BP, HbA1c, and all. Discuss the home monitoring and schedule follow ups. And the preventive services we can do is for immunization, screening for cervical or breast disease, tobacco cessation. And so, these are things you can do as a preventive service. Prescription writing should be clear. Drug, dose, duration, follow plan should be mentioned. And if suspicion for serious, any kind of serious disease exists, explain the referral to the patient and arrange the timely specialist evaluation. So that is how you can do the OPD. Like that is the how we'll managing the patient and the OPD level under like as a family physician. Next is the inpatient management. So, although family physicians work mostly in the OPD, IPD roles include coordinating admissions, managing common inpatient problems, and ensuring continuity at the discharge. Typical inpatient tasks are manage the sepsis in the early stages, dehydration, exacerbations of COPD or uncontrolled diabetes, and provide perioperative optimization and all. In OPD, in IPD, we focus on the stabilization, multidisciplinary care, and discharge planning, including home medications, rehabilitation needs, and follow up arrangements. Communication with the specialist must be clear and state the working diagnosis, why the patient was admitted, what we want from the specialist, and the expected follow up routine. So, good discharge summaries reduce the readmission. That is the key point here. So that's about the IPD management, like how that is about the role of family physician in the IPD level of management. Next is the preventive and rehabilitative role. So family medicine strongly emphasizes the prevention and the rehabilitation. Prevention means through the lifestyle modification counseling, immunization across the lifespan, screening programs, and risk factor control, all done opportunistically during the visit. That is the how we'll be doing the prevention and rehabilitation after acute events or for chronic disease, stroke, COPD, orthopedic injuries, and all. Family physicians coordinate physiotherapy, home care plans, and social support. And a practical point here is always screen for mental health and social determinants. And these commonly affect the recovery and adherence. By integrating prevention and rehab, family physicians improve long term functioning and reduce the disability. So, community outreach or small group counseling as the practical methods you can do. Next is the scope of family medicine. So I'll do the scope of medicine summary together. So scope of family medicine means it covers all the age groups and disease spectrums. It extends from the preventive to palliative care and integrates clinical care with public health and community outreach and plays a very important key role in strengthening the health system and national programs. So family like to summarize, family medicines bridges the preventive, curative, and rehabilitative care. It is a comprehensive across ages, continuous across time, and integrated with the community health. So, clinically, family physicians manage the common OPD conditions, coordinate with the inpatient care when needed, and provide the preventive and rehabilitative services. The role reduces the healthcare's cost and improve access and strengthen the primary care. The key important clinical takeaway for today's session is focus on the history and context, use cost effective investigations, prioritize patient education and follow up, and ensure clear communication when referring. So that concludes our session for today. Uh, so I hope you got a clear idea of what are the concept and like of family concepts of the and how it is evolved and what are the scope of family medicines in the today's session. Hope you got a clear idea regarding the topic today. Thank you so much. Have a nice day.